Right, joining us live now is Esther Moirori. She's a Programs Officer, Disaster Risk Reduction, Climate Change and Adaptation Environment at the Kenya Red Cross. Esther, 31 out of 47 counties. I mean, that's pretty bad.
Yeah, that's bad. Jeff, and this is a situation that has progressed within the last 2 years, where we have seen the performance of our rain seasons being poor and indeed affecting our food production systems, the water availability and pasture availability for the livestock. And as we had seen, the most vulnerable counties were the ASAL counties, which now we have 20 out of the 23, either in alarm or alert phase. And now we are looking at 9 additional counties where pockets of different wards are also in the alarm phase. Yeah, and when you look at the last year, numbers have also been increasing. By the time we were having the drought declared a national disaster last year in September, we're talking about 2 million. Now we are at 5.1 million, and the situation is getting worse. I
was about to ask you, Esther, is that number going to rise if these November, December rains don't come through? Will the numbers rise?
Currently, what we have seen with this season's performance is we have had late onset of rains across many parts of the country, and there has been poor distribution of rainfall, and rainfall amounts have also been poor. So definitely with those observations at the moment and the projection that the cessation of the rainfall will also be early, as opposed to what we have seen traditionally, then we will have a situation where this is likely to worsen. And also remember that even if we are currently receiving some rainfall amounts which are not enough, looking at our long-term average mean for this season, the immediate effects or the impact of rainfall are not felt at this stage. They are long-term because we need to see how it is going to improve the pasture regeneration, the food crops. But even in our food basket counties, we have seen that the projection for this season is going to be below normal. So we are looking at a situation where the situation can only get worse because even the amount of rainfall that is going to be there, farmers may plant, but the yield will not be as traditionally harvested by the farmers.
Yeah. Are you surprised as that some of the counties are named in Ayub's piece? That's Kiambu, Murang'a, Siaya. Are you surprised?
I'm not surprised, and this is because for the last 2 years we have had below normal average rainfall in many parts of the country. And for this season, even Kiambu, Siaya, those we traditionally know are among the food basket counties, we are now seeing that the projection is that they are not going to have the normal rainfall as experienced in the previous years. And even though it is not affecting the whole of these counties that are now coming on board, it is concerning because it shows that there is something that is happening, and I would like to link this to the changing climate, the climate change, because what we are seeing and what we have had science tell us is the fact that climate change has the potential to expand geographically the hazards that never traditionally existed in some areas. And what we are also seeing, for example, is the expansion of vector-borne diseases like malaria to areas where we'd not experienced malaria before, because we are providing an environment that is suitable for breeding to happen. It's the same case now. The planet is becoming hotter. The places where we traditionally expected rainfall patterns to be normal, they have been disrupted over time. So this is quite concerning, because if the counties where we depend on to produce food are also being affected, then it raises a lot of concern to food security in the long term.
Tell me something, Esther. How much worse can the situation get?
The situation can get worse, and what we have seen, for example, for the past few weeks, even children are missing schools because they don't have meals, and that's why this week, specifically for Kenya Red Cross, working closely with the government and other partners, including private sector, is to accelerate food access and availability in our schools. And the situation will not get easy, because we are saying, even if we are seeing some rainfall amounts happening here and there, they are purely distributed in spatially and also in terms of amount. And even if we are to say that the rainfall is supposed to alleviate the emergency that we are seeing now, the impacts are not instant. They take time to generate pasture, for example. It takes time to have impact on the food system. So we are likely to see numbers increase for the people in need, because even now, what we are seeing from the rainfall projection for March, April, May rainfall, the situation is likely to be below normal. Of course, with the caution that normally when it comes to projecting the March, April, May rainfall, it's never that clear, because the drivers of the system are not well understood by the science. But early indications show that it is likely to be below normal. So if it is going to be below normal, then that means even the situation in the counties where they are in alarm stage, it is likely to get worse. So giving an example of the IPC projection is that by December, 5 counties will be in emergency state. So the situation is not getting easier, and it's not getting well as time goes by. And what we can say is that we need to bring a lot of concerted effort to provide the emergency support that is currently needed.
Yeah. Tell me something. If there was a wish list, or if there was a number that the country needs to turn this thing around, how much do we need?
Oh, wow. I may not give the amount that is needed, but I can say the priority needs that are currently on focus right now. The priority needs for the most affected counties is food assistance, both cash and voucher assistance, and the food itself. But also we are looking at the water sector. Counties that are affected need water availability, water access, and also in terms of health, both for human and livestock. We need a lot of support towards ensuring that people affected by malnutrition, we are talking about more than 940,000 children below the age of 5 with acute malnutrition, more than 134,000 pregnant and lactating women with acute malnutrition and need of treatment. So those are the most urgent interventions that are currently required. Again, when it comes to livestock, we have seen the loss that we're experiencing. 2.4 million livestock deaths. That's a lot of loss. And what we are seeing as an immediate intervention towards that is vaccination, veterinary services, but also animal offtake, which is a program that Kenya Red Cross is taking part in partnership with the government, so that we can be able to support the most affected families to sell the animals that are doing very bad in their house, and they can be able to use the money they get to provide for their families.
Absolutely.
Yeah.
Esther, we'll have to leave it at that and wish you all the very best. Thank you so much for passing by.
Thank you so much.
That's Esther Mwirori. She's the Programs Officer, Disaster Risk Reduction, Climate Change, Adaptation and Environment at the Kenya Red Cross.